Hey guys, I'm Dan,
I'm Mike.
And I'm AJ.
and the title of our research design is called Internal versus External Motor Control Cueing to Facilitate Lumbar Multifidus Activation with EMG in Healthy Adults. So current research suggests that low back pain has become quite of an epidemic in developing non-specific chronic pain. This affects both patient outcomes and money spent on healthcare. So we as PTs, we treat low back symptoms, but so do a lot of healthcare providers. We need to distance ourselves by implementing evidence-based care and effective treatments for patients with low back pain.
The multifidus presents itself as a key stabilizer in segmental lumbar stability. Patients with chronic, nonspecific low back pain often lose the ability to recruit the multifidus through loss of neuromuscular control, which leads to decreased cross-sectional area of the muscle, or muscle atrophy.
Current research has shown that patients have the ability to recruit the lumbar multifidus through the use of potential or postural motor cueing during exercise by increasing lumbar lordosis or anterior pelvic tilt. So by using this model, we sought to experiment with the use of motor control cueing to boost lumbar multifidus activation in an external cueing group and an internal cueing group.
So the participants in our study included healthy adults between the ages of 18 and 50. The exclusion criteria consisted of current hip, knee, ankle, or low back pain, or any previous lower extremity or lumbar surgery. So everybody in our study was randomized into either two experimental groups, an internal motor control group and an external motor control group. The activation of lumbar multifidus and the superficial erector spinae were attained with the use of surface EMG electrodes.
We then took a baseline measurement of the erector spinae and multifidus at rest in a standing posture and with a maximal muscle contraction, or MVIC, with a sustained isometric hold against gravity on the table. Participants in the internal cue group were asked to bring your pelvis forward, whereas participants in the external group were asked to grow tall toward a mark located 1 inch above their head.
Lumbar range of motion was measured during the 3 trials of each motor control cue in the standing position, using dual inclinometers. This was to see if any cue would influence movement in the lumbar spine, ultimately activating one muscle more than another.
Some of the strengths for our study include randomization of the subjects into groups. The methodology was carried out by the same researcher. What I mean by that is I did all the palpation, Mike applied the electrodes and the range of motion, and AJ applied all the verbal cues. Also, we validated the research to target the multifidus in patients with low back pain. Research to place the EMG electrodes for multifidus and both for erector spinae. We had over 75 participants in the study, and we calculated the percentage of maximal contraction of both the multifidus and the erector spinae.
Some of the weaknesses of this research include multifidus is accurately measured with fine needle EMG, accuracy of palpation and bony landmarks. Majority of patient population included PT students who were aware of their lumbar multifidus muscle, so the potential for better activation. There were more females than males in the study, and the study could only be performed while at school since we all live at home.
Some of the opportunities that this project represents are providing clinical relevance in relation to which type of motor cue works best, internal versus external, specifically for activating the multifidus, providing helpful tools to threatening low back pain, provide objective muscle activation analysis for the multifidus.
Some of the threats we faced during our project included patient recruitment strategies, inexperience because we're all students doing research for the first time, and obviously resources that were available at the school, and being that we do live all at home, the school was pretty far away, so we all had to meet at one place every single time.
So that's our study. Good luck, you guys. Our recommendation is to start data collection early. We give permission to use this video as Research 1 course material.
See ya.